Signs that you are suffering from a calcium deficiency. Although somewhat common, calcium insufficiency can be challenging to diagnose. How can you tell if you're deficient in calcium? Numerous health problems, including tingling in the hands and feet, muscle aches, irregular pulse, weariness, and even memory loss, can be brought on by calcium insufficiency. Low levels of calcium in the blood are referred to as hypocalcemia or calcium deficiency illness. The mineral calcium is the most prevalent in the human body. The bones, heart, muscles, and neurological system all depend on it. Your body needs calcium for every cell. While 99% of your calcium is kept in your bones and teeth, just around 1% is found in your blood. What are the signs of hypocalcemia? Early indications of a calcium deficiency may not be apparent. It is typically not serious, but if left untreated, it could be fatal. Due to its importance for numerous bodily processes, calcium insufficiency can have far-reaching repercussions on the muscles, bones, teeth, and even mental health. There are typically no early signs if a deficiency is caused by poor food intake. A person may develop osteopenia or reduced bone density over a long period. Osteoporosis, or brittle bones, can result from this if not treated. However, a calcium deficit is typically not caused by a lack of nutrition only. As people age, the risk of calcium insufficiency increases. There are numerous potential causes of this deficit, including inadequate calcium intake over time, particularly in children who may be taking medication that affect calcium absorption, hormonal changes, especially in women, food sensitivity to calcium-rich diets, and specific hereditary factors. Let's take a closer look at the signs of a calcium deficit. Number 1. Muscle concerns. Symptoms of a calcium shortage include muscle pain, spasms, cramps, tingling and numbness in the hands, arms, feet, and legs, pain in the thighs and arms when walking or moving. Although these sensations may come and go, exercising does not usually make them go away. Extreme feelings may be a sign of a more serious deficit. Number 2. Extreme tiredness. Extreme exhaustion, which includes a lack of energy and a general sense of sluggishness, can be brought on by low calcium levels. Additionally, it may cause sleeplessness. Along with fatigue, a calcium deficiency can also cause lightheadedness, dizziness, and brain fog, which can cause difficulty concentrating, forgetfulness, and confusion. Although the bones are good at storing calcium, they need a lot of it to remain sturdy. When calcium levels are low overall, the body may take calcium away from the bones, making them brittle and more vulnerable to damage. Osteopenia, a decline in the mineral density of the bones, can develop over time as a result of inadequate calcium intake. This can result in osteoporosis, which thins the bones and makes them more brittle, as well as pain and posture issues. Osteoporosis and other calcium deficiency-related problems might take years to manifest. The precise causes of premenstrual syndrome, PMS, which is relatively widespread, vary. It can be triggered or made worse by low vitamin D and calcium levels. In some situations, calcium and vitamin D can lessen or even eliminate PMS symptoms. Number 5. Depression. Calcium insufficiency may be associated with mood disorders, including depression. Anyone who thinks their depressive symptoms may be caused by a calcium shortage should see a doctor. The doctor may suggest a calcium supplement after determining the patient's calcium levels. Hypocalcemia may manifest as dry or scaly skin. A lesser-known function of calcium is to support healthy skin by lowering the pH of the skin and preserving the skin barrier. This stops the skin from losing too much water. The skin can no longer keep moisture at a proper pH when calcium blood levels are too low. Number 7. Seizures. Calcium is necessary for both muscular contraction and neurotransmitter release in brain and body cells. Hypocalcemia can cause the brain to become overexcited and cause seizures. Irregular heartbeat is a common sign of hypocalcemia, and in severe cases, it can be fatal. It frequently results in several anomalies. Given that the heart is a muscle, it is not surprising that a calcium deficit might cause problems with the heart. Heart cells can stop functioning properly if they don't receive enough calcium. This may disrupt the regular heartbeat, resulting in cardiac muscle spasms and restricted arteries. Number 9. Tooth decay and gum disease. Your teeth are strengthened by calcium. Minerals in the teeth can be broken down by food, beverages, and oral microorganisms. It takes a sufficient amount of calcium to stop this mineral loss. Additionally, research indicates that a calcium deficit is one of the causes of gum disease. At all ages, it is critical to guarantee appropriate calcium consumption. The recommended daily allowances for calcium for children and adolescents are the same for both sexes. However, women should start increasing their calcium consumption in their middle years earlier than men do. It's crucial for women to meet their calcium needs as they get closer to menopause. Women should consume more calcium throughout menopause to lower their risk of osteoporosis and calcium shortage diseases. Women's bone thinning during menopause is due to the hormone estrogen's reduction. You won't suddenly become calcium deficient if you forget to take your daily calcium supplement. The body utilizes calcium quickly, so it's crucial to make an effort to acquire enough of it each day. Because they don't consume calcium-rich dairy products, vegans are more likely to experience rapid calcium deficiency. Short-term signs of a calcium deficit won't appear since the body gets its calcium needs by directly absorbing it from the bones. However, persistently low calcium levels can have negative consequences. How can hypocalcemia be diagnosed? Your doctor will take a blood sample to assess your blood calcium level if they feel you may be deficient in calcium. Your doctor will check your levels of albumin and total calcium. A protein called albumin binds the calcium and carries it through the blood. A diagnosis of calcium deficiency disorder can be confirmed by persistently low calcium levels in your blood. According to the Merck manual, adult normal calcium levels can range from 8.8 to 10.4 milligrams per deciliter. If your calcium level is less than 8.8 milligrams per deciliter, you may be at risk for calcium deficiency disease. Blood calcium levels are typically greater in children and teenagers than in adults. How is hypocalcemia treated? Treatment for calcium insufficiency is usually simple. Usually, this means increasing the calcium in your diet. Avoid using excessive amounts of calcium supplements as self-medication. Without your doctor's clearance, exceeding the advertised dosage can result in significant problems, including kidney stones. The following calcium supplements are frequently advised: calcium phosphate, which is also well absorbed and doesn't induce constipation; calcium citrate, which is the most readily absorbed; calcium carbonate, which is the least expensive and contains the most elemental calcium. There are chewable, liquid, and pill forms of calcium supplements. Regular sun exposure can also help increase your vitamin D levels, since sunlight stimulates the production of vitamin D in your body. Changes in lifestyle. There are certain lifestyle modifications you may do to support bone health, in addition to maintaining good calcium and vitamin D levels. These consist of preserving a healthy body weight, engaging in regular exercise, and abstaining from alcohol and cigarette use. It's imperative to remember that some drugs and calcium supplements may interact poorly. For example, taking blood pressure beta blockers within 2 hours of taking calcium supplements may reduce calcium absorption. Similarly, a cholesterol-lowering medication may reduce calcium absorption and increase calcium loss in the urine. Estrogen therapy may also increase calcium levels in the blood. Diuretics can either increase or decrease calcium levels in the blood, and some antibiotics absorption can be decreased by calcium supplements. If you enjoyed our video, give us a like and keep watching your screen for more content.